So common issues that we're seeing at Nagar Women's Health House on the daily reports, if you can elaborate more on that.
So every day we are presented with women and children. Sometimes we get men also. So chest infections or upper respiratory tract infections are very common, and especially in winter season. Then we have urinary tract infections, mainly in ladies. And these can be, if left untreated, these can be very detrimental to the health of the women, especially if they are of childbearing age. And we see pregnant women. The best part is we can do antenatal care, which is very important, in which we treat anemia. Anemia is very high in women and children because lack of nutritious food and lack of iron and vitamin B and folic acid deficiency. Then we see calcium deficiency also. Calcium deficiency is there because lack of provision of milk and vitamin D, as a lot of them don't work out in the sun. They remain either indoors or they remain covered, so they have a lot of vitamin D deficiency also. Then other than UTI, we have seen cases of vomiting and diarrhea. That is again due to lack of clean drinking water and sometimes food poisoning. And asthma is very common, especially in children. And we have then worms, and worms are easy to, that's again because of not having clean drinking water, not having means to boil water or to pass it through a filter. So many things can be done to improve provision of clean drinking water. There we can also provide them methods to how to sterilize water in sunlight. We need to work on that and teach them that also. Then what I have seen is that if you give them correct medication and if you give them vitamins and calcium and vitamin D, especially in children also, if you give them syrups of vitamin, it really improves their health. Because in school-going children, we have seen the provision of multivitamins and calcium did affect their health status. And the periods that they were not given that medicine, it really put their health down, and they could not concentrate on their studies, and they could not do their other chores properly. So that's also very important. The antenatal care in our clinic is very important because we have an ultrasound, and our medical staff is trained to use that. And I cover the quality control and I see the reports daily. So we have to, that's really helpful because ultrasound does help patient with proper growth and development of the fetus, and it makes us aware that we have to give the mother the right amount of iron, vitamins or nutritionist advice. So that's